Nice.
Right. I so appreciate that, Dennis.
We had quite a time yesterday.
Good at the Denver meeting, at the community meeting.
Yeah, the listening session. It
Awesome.
was a small group, but we were all really engaged. It was pretty cool.
Oh, I love that. I'm so sorry I had to miss it. I work two jobs, and so throughout the week I have a night job as well. So I was there, unfortunately, but I'm so glad you
Well,
made
she said she knows who you are, so
it. Hopefully that's good. Yeah. No, I love Commissioner Smith. She's absolutely wonderful. I'm so thankful for her leadership. Good morning, Hope. How are you?
Good morning, Caitlin. I'm good. How are you? Good morning, Dennis.
Oh, doing well. I hope everything's going okay for you.
Thank you. I appreciate that. Thank you for all your support on Friday. Appreciate you.
Of course, of course. Good morning, everybody. Morning. How are you all? Morning, Megan. How are you?
I'm good. My kid got her driver's license yesterday. So today was the first day. She was like, "Bye, mom," and like just grabbed the keys and left. And I was like joyful and also tearful and a little nauseous. And oh my gosh, this whole parenting teenager thing is something else.
That's so exciting and sad all at the same time.
How are you? How was your long weekend?
It was good. It was good. It was pretty relaxing. Went to a concert one night and just hung out around the house, caught up on a bunch of housework. So yay, home ownership. When we first bought the house, my boyfriend and I were like so ambitious. We're like, we're gonna get everything done in the very beginning so then we can just relax. And now we're like, oh, it's never ending. Like so now we just have to prioritize like one task a weekend.
Well, good for you guys.
All right. It looks like Shane got us up and recording already. Let's see here. Got a good group coming in this morning. Good morning, everybody. So good to see everyone. We'll give it another minute or two before we get started. Let some more people join on in.
Good morning, Ryan. This is Tasha. I've missed your face, man.
Hey, good morning, BPAC. Good morning, Tasha. I know it's good to be here. This is always exciting. I like BPAC. I like advisory councils. Um, I had a really good conversation with a friend about how BHA can utilize feedback that we get in a whole bunch of different settings and actually utilize that feedback and drive initiatives. So hopefully this can be a new start to that.
Aaliyah, are you at the symphony?
Yes.
Oh my God, what a cool picture. Hi, good morning.
This is actually just a Zoom. It's a Zoom one.
I have to look at some new backgrounds, apparently.
Yeah. It's good. It's good. I just can't keep, I had this cloffice built and I have all this nice stuff behind me. I just can't keep it together. I just can't keep it clean. So everything's messy all the time.
A cloffice?
No,
I like that.
oh, it's not too bad now. There's not like clothes all over my dress.
All right, I'm gonna go ahead and drop the agenda in the chat for everybody. If you haven't already received it, you should have received it in an email. I believe it was last week or the week before. I know it was pretty early this week with him, so all my days are blending together. You get one day off of the week and everything's just kind of like time and space are no longer real. All right, but I will go ahead and share my screen for everybody as well. All right. Can everybody see this?
Yes.
All right, perfect. Well, with that, we can go ahead and get started and I will pass it over to you, Hope.
Amazing. Thank you, Caitlin. I guess we're going to call to order our September council meeting. Thank you. First order, we're going to read the roll call here. If I botch anyone's name, please tell me. Like I would like to get it right. So tell me, and if I do it again, just tell me until I get it right. So just putting that out there. All right, we'll start with Aaron Black. Let's see, I can't see everybody. I don't believe Aaron's here. I can't see everyone's faces, so if I miss.
Yes, if you all could come off mute and say if you're here today, because we do have a lot of participants today, which is wonderful.
Thank you. Appreciate that. Natalie Brown.
Present. Good morning.
Good morning. Savannah Brown. Charles Davis.
Present and good morning.
Good morning. Thank you. Carrie Eckert.
Present.
Good morning. Jacob Fry.
Good morning, everybody. Present.
John Gartrell.
Good morning. Here. Present.
Kelly George. Lorene Gilroy. Marjorie Grimsley.
Present.
Jenny. Good morning, Margie. Jenny Guencheva.
Good morning, everybody. I'm present.
Good morning. I'm present as Hope Hyatt. Stephanie Johnson.
Present.
Megan Lovelace. I saw you.
Present.
Candace Ludwig. That's Charlie and Ollie apparently are present today. Amy Leiden. Dr. Asia Lyons. Sharon Mach. Michael Miller. Mary O'Hara. Dr. Camille Sinclair. Dennis Streeter.
I'm here.
Angie Wold. And Annette Zacharias.
Good morning, I'm here.
Good morning. For some reason, everything but my agenda is showing and it's also on here as well. Next. So Caitlin, you did send out the minutes. I think it was like last week, last Monday or something. And I hope everybody has had time to review. Are there any corrections to the August minutes?
Oh, Rachel.
Yeah, I'm here. I just wanted to make sure that's recorded. Thank you.
Thank you so much. I think we went off an updated list, so I just want to make sure. We have Ben Nichols in today. All right. What about Phyllis Reed?
She's not here yet. My name is Christy Elliott, and she asked me to join until she could get here.
Thank you so much. What about Kristen Toombs or Susan Wagner?
Hi, this is Kristen Toombs. I'm here. I'm going to have to leave a little early. I'm interviewing for a position we are desperate to fill, so I apologize. I'll come back as if I can, depending on how long that takes. But I'm here for what I can be.
Thank you so much, Kristen. And then Susan Wagner. All right.
So I was not reading the most current list. Is that?
I think you were reading like the super current list. So we'll we started including some new members on our new list. So that's why we have some absences today. So I'll get you the current list right over there, Hope. All right. So here is a copy of the BPAC minutes that is also linked to the agenda as well.
I didn't see anyone's hand come up for any corrections. So can I get a motion to approve the August minutes?
I move to approve the August minutes. This is Annette.
Second?
Charles Davis, I'll second.
Wonderful. All in favor of approving the August minutes?
Aye.
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 Opposed? All right, August minutes are approved. Next order of business from our membership subcommittee update.
Right, subcommittee. Who wants to talk about our new member recommendation?
I guess I can kind of bring everybody up to speed here. As the membership chair, I helped review everything along with Megan and Hope, and we came up with, actually we had more applications than seats to fill, which is the right kind of problem. And again, without going into too much detail here, we were collectively very interested in transparency and being able to share how we came up with our selections. And we did look at the qualifications and what each individual would be able to bring to the council, and how important that expertise would be in moving the council forward. We also were very sensitive about an inclusive council, looking for, and we do have much more diversity now, thanks to our 6 new members. Actually, it'll be Margie Grimsley was reappointed unanimously to the council. So she's not new, but she certainly is welcome back. And we're very excited to have that. So again, we were very detailed and conscientious about how and who we selected. And the others that are not selected are going to be invited to join the meetings as non-voting members, and with the knowledge that as openings come up, they will be considered in the future for our new members. So, Hope, Megan, have I forgotten anything?
No, I think that was great, Dennis. Thank you.
If you wouldn't mind, I'll just tell the group kind of next steps moving forward, if that's okay. So, first of all, we wanted to go ahead and make a motion, and I'll turn that back over to Hope to adopt our recommendations. But basically, when you click on this link, all of the members will be able to see who has been nominated to move forward to the commissioner. So ultimately, though we are an advisory council and we can advise on who we would like to have sit on the board, the commissioner has the ultimate stamp of approval. So what we are doing right now with the membership committee is we are working through an applicant referral package that includes, current board composition, which we'll look at in just a minute, as well as our appointees that we would like nominated for the board. It has things such as like our statute, so the commissioner can refer back to that when we're making recommendations for specific seats. Yes, Jenny, you absolutely will. We'll be welcoming them and onboarding them as soon as we get back that stamp of approval from the commissioner. So what we'll be doing this afternoon is I'm going to be meeting with Hope and Megan, and we're going to be finalizing this with, just some formal signatures, getting a letter of recommendation over to the commissioner. I'll be working with Andrea and Ryan to make sure that everything looks good on their end as well. And then we will be sending this over to the commissioner to review and approve. So that should take a couple of weeks. And then when we get that back, I'll be working with the membership team and Hope and Megan as well to welcome new members. We'll be sending them some training materials, a letter of commitment, just kind of explaining again their roles and responsibilities as a council member, just being prepared, being, caught up to speed on what we're doing here, professionalism, etiquette, and just respect for the council and our members as well. So that's going to be kind of next steps coming down the line. So we'll be getting this over to the commissioner probably by end of day today, after you all have made your motion and we move forward with these candidates that was selected by the membership committee. And then hopefully by next meeting, we'll have our new members joining us. And as Jenny asked, we'll do some brief introductions with them to learn a little bit more about them, their personal and professional experiences, and the unique qualities that they're going to be bringing to this council. So any questions on that before I shoot it back over to Hope? All right, not seeing any big red flags. So Hope, I'll send it back over to you all.
Thank you, Caitlin.
Excuse me, just one follow-up here. Again, this was my first rodeo on as the membership chair, and one of the things we discussed was the authority of the membership committee to make these appointments, these recommendations to the commissioner, and at what point, because of the need for keeping certain information private for people, the entire council would have information. And I'm not quite sure if we resolve that. So, I mean, again, I mean, we can cover it in the new bylaws for sure. But again, with the thought of transparency, is the council going to give authority to the membership committee? We even talked about having a more open membership committee meeting where anybody and everybody is invited to be a part of the meeting. So, Hope, I'm going to throw that over to you and see where we are.
Well, no, I think that's a great point, Dennis. Of where we landed with that was wanting to bring the whole council into the process, and so leaning into that the membership subcommittee not having authority to make decisions on behalf of the council. So thank you so much for bringing this up. And so I mean, turn this over to to the council. How does everyone feel about being more a part of the recommendations, not having the membership subcommittee have authority over new member recommendations? Anybody have any thoughts they'd like to share on that?
If I can jump in, Hope, kind of what we were talking about is, using the subcommittees as an extension of the council as a whole. And so basically what we were talking about is, when it comes to these recommendations, the membership committee, doing work on behalf of the council of sifting through all the applicants and making recommendations based on the needs of this council, the qualifications of the members and things of that nature, and then bringing it back to the council as a whole for that official motion. So that's why here we have the motion to adopt recommendations specifically. So that way, the membership committee isn't making the ultimate decision, but it is doing its job, and that it is an extension of the council. It's the one that's kind of going to be sifting through all the applicants and coming up with that recommendation list to bring back to you all to make that formal motion. And so you all did have the link to this, and I specifically mentioned it in the email as well. That, click on it and go through it. What we're not trying to do at this moment is just, share it on screen, just because we do want to protect some of the more not necessarily personal information, because we don't have emails or phone addresses and things like that on here. But what we're going to be doing in the future is incorporating a question into the application that makes sure that the council member, the applicants are comfortable with us sharing some of the demographics and, their personal and professional experiences with the council as a whole, and making sure that they understand that that is going to be done on a public platform. We don't have that for the old application, and so that's what we just wanted to kind of address. So that's where we're at with this predicament. But in the future, this shouldn't be an issue. But hopefully, if you all are comfortable with it, still the membership subcommittee working on behalf of the council to bring forth these recommendations for you all to make that formal motion approval. So I see a couple of hands up. Jenny?
I wanted to share that I had really good experience in the process of communicating the need for my participation. And I think the membership committee has created that infrastructure that allows kind of a good level of familiarity with what we would be doing. And so it's a twofold process. The membership committee works with the whole group, but also with the potential applicants. And so I appreciated that. I appreciated the information that is provided, and really think that that was very helpful. And from my experience with different state boards, it's always nice to have a group that is primarily responsible for the implementation of that process. And of course, hopefully they'll communicate with all of us timely and effectively.
Hey, Jenny. Anybody else?
This is Megan. Caitlin, I wonder if maybe we just resend that great sort of welcome packet with the video and everything, so everybody can kind of review that and feel if that still feels good for our new members.
Yes.
Just so that we're all kind of refamiliarizing ourselves with that. We scrambled on membership a while back, and so it's possible we just need a refresher on all of the great work we've done around preparing our new members and refreshing our current members with the literature and the video.
Absolutely. So Nat actually mentioned something about that, the orientation for the whole council, possibly in October. And I think that that's a great idea. First of all, for the new members, we will be sending them a welcome package. So again, that's going to include like the video that's linked to our website. It's going to include our website link so they can have access to all of our our previous agenda meeting minutes, as well as all of our video recordings that are on our YouTube playlist that's linked through the website. We're also going to be having our letters of commitment signed. Again, that's just going to kind of detail roles and responsibilities of council members. But I think for, the October meeting, as long as we do have our new members formally appointed at that point, we could use that meeting as just a refresher for the council as a whole. And so that way we kind of, go over again roles and responsibilities as the council, look at our previous work that has been done, and start planning for, our next year as a council as a whole. So I think, we could go over the training slide decks and everything like that as well during the council meeting in October, just to kind of get everybody on the same page, do a good refresh, restart, so that way we start the new fiscal year understanding and really strong. So we can talk more about that in the executive subcommittee meeting that's going to be coming up in a couple of weeks. But does that sound kind of agreeable to the council as a whole, to use our next meeting just kind of as a restart, refresh, kind of get everybody on the same page, answer any outstanding questions? Seeing some head nods. No red flag. All right, sounds good. Great. So we'll go ahead and talk about that more in the executive subcommittee meeting when we're starting to plan next month's agenda. But, for the sake of time, do we want to go ahead and move on to motion to adopt our recommendations? If nobody has any further questions or anything right now.
I so move.
Thank you, Jenny.
I will second. Oh, either one of us.
Yeah. We have lots of seconds. Great.
All in favor of the motion to adopt recommendations to commissioner?
Aye.
Aye.
Recommendations to commissioner are approved. And thank you, Jenny, for your feedback. That's really helpful to hear. And Nat, thank you for that suggestion. As I consider myself a newish member, this would be helpful for me and for all of us to just kind of get on that same page and have that refresh. So thank you for those wonderful suggestions.
Of course.
Now moving on to current council membership positions review.
All right. So wanted here specifically, when we're looking at our bylaws, again, this information, first of all, can everybody see my screen? Okay.
Yes.
Never know with technology. Some days it works, some days it doesn't. So specifically looking at the bylaws, which we're going to be holding some office hours to work through, and I'll talk about that in a little bit as well. Wanting to look at the language around membership. So this is taken directly from statute, as you can see up here at 42 U.S. Code 300X-3. So these by statute are the required seats that we have to have for this council. And so when we're looking at the seat assignment sheet that I'm going to be pulling up in a second, you all are going to be divided in these seats, basically. I want to point out that we understand that you bring so much more to the table. And although we have you categorized like this is just a formality for statute. We understand that you have lived experience, you have professional experience, you bring so much more to the table than just this seat. However, because of statute and because of our federal block grant applications, the federal government asks us what person is in what seat, and so that's why we have to categorize you accordingly. So based off of your applications and some of your lived and personal experiences, we kind of took a stab at this, but wanted to bring this up to you all to make sure that that is the role that the seat that you feel most comfortable in. And we can definitely work through this and change this as you all see fit according to your specific positions and things like that. So just wanted to kind of go ahead and throw that out there. Again, we realize that this is not who you are, and we're not trying to define who you are by any stretch of the means. It's just a formality for our application. So let's see here. Oh. Okay. So again, this is going to be taken from your applications that you all submitted previously. And then again, the seat and position is going to be required according to the definition of statute. So that's the only thing that we have here. Again, we wanted to make sure that you feel comfortable with that. So we'll just kind of go through each name, depending on who is here, and just make sure that, you know, you all feel comfortable with this. This is one of the pieces of information that we're sending over to the commissioner for her formal review and appointment. So this is just going to show her, you know, what the council is currently made up, who is currently serving on the council, so she can compare that to the applicants that we have referred. So she kind of gets like the full roundedness of the council when she's looking at this information. So do we have Erin Black here? I know she wasn't here earlier. Just wanted to see if she joined. Okay. What about Natalie Brown?
That looks good to me.
Okay. Thank you, Natalie. Charles Davis.
The only change, I have moved into the next age sector since the application. So I would be in the 60+ category.
Okay. Thank you.
And
You don't have to tell on yourself
34
there.
years, 34 years of service.
34. Awesome. Thank you so much, Charles. Okay. Let's see here. Carrie Eckert.
Looks great.
Thank you, Carrie. Jacob Fry.
It's good.
Thank you, Jacob. Sean Gattrell.
Looks good.
Thank you, Sean. Laureen Gilroy. I don't think we had her here today. Jenny, I'm sorry, Jenny, can you tell me how to pronounce your last name?
Gencheva. And really, however you pronounce it, that's fine. Yeah, there's this U that sometimes you can hear and sometimes you can't. So it's fine. Yeah.
All right, Jenny. Thank you so much. Does it look all right for you?
That looks good. Yeah.
Perfect. Thank you. Hope.
Yes, thank you.
Thank you, Hope. Stephanie Johnson.
Looks good.
Thanks, Stephanie. Megan Lovelace.
Looks good.
Thank you, Megan. Candace Ludwig. Do you have Candace? They might have had to drop. We'll come back. Amy Linden. No Amy today. Sharon Mock. No Sharon. Michael Miller. No Michael. Dennis.
That looks good.
Thank you, Dennis. Angie Wold. She's not here today. Annette Zacharias.
That looks good.
Thank you so much. So then the rest are just going to be our state agency representatives. So just for the commissioner's review approval with that. All right. So with that, we'll kind of move that information forward to the commissioner. Again, just for her comparison and review and approval of all of the hard work that you guys have been doing. All right, so wanted to quickly move on and ask you all about providing me with some bios for you all that we can take and put on our public facing website. So I'm going to just quickly pull up a link here to show you kind of what I'm referring to.
Wouldn't mind, Caitlin. Thank you.
Recording again.
Apologize for the brief hiccup. Should be solved now.
Yeah, the second he logged on, it started recording. So it must be something with the Zoom account. So this is our current BHPAC website, and I am working with our comms team to kind of get this a little bit more up to date and things of that nature. And we want to do kind of a refresh. And instead of having like our members listed here, like we currently do, we're looking to do something similar to what the Behavioral Health Administration Advisory Council has. And so if we look down here, we have the names, the pronouns, and a little bit of information about each one of our members. We do need to update this list as well, which we absolutely will be. But wanted to kind of do something similar for this council. So that way, you know, when people are looking at our website and trying to learn more about each of the councils within BHA, they can see, you know, who's made up of the council, our current demographics, where their personal and professional backgrounds lie. And so I wanted to kind of bring that forth to you all to see if this is something A, that you would like to do, and then B, if you could give me some information, and I can absolutely help you write with these bios if you want to just give me, you know, a couple of talking points. You don't have to necessarily put it all in a beautiful paragraph format as well. I'm happy to do that for you all as well. But just kind of wanted to throw that out there to the council this morning and get some feedback as well.
I think that would be great. I really like the way that BHAC has those lined out, and it tells us a little bit about who are making decisions and where they come from. And I really liked I like seeing who they were, and I think people might like to see who we are.
Thank you, Annette. I agree.
As a state employee, I can share that I know from an accessibility perspective, so if folks would need assistance with having the website read, having the members' names listed out like that helps make that possible instead of having a link like we currently have. So just if folks are from that perspective, to making sure that it's accessible if anybody would need to have the website read, I think that's nice to make it accessible to folks.
Thanks, Kristen. You're awesome.
Thank you for that, Kristen. Anybody else? Any concerns with this? Not seen any big concerns. So if it is possible, if you would like to write your own bios, great. We're looking for about, you know, 2 to 4 sentences for each person. And then if you would not like to write your own bio, if you could at least get me, you know, a couple of talking points that I could share again on our public facing website. So whatever information that you feel comfortable having on our public facing website, if you could get that to me by the end of the month, so Friday, September 27th. Is that agreeable? Is that an agreeable timeline for everybody? That gives us about a little over 3 weeks. Great. And I will, of course, send out reminder emails, and then, you know, depending on who's left, I'll start bugging you. So, so just keep an eye out on your email. But thank you all for your willingness to do that. And, you know, I think just as Kristen said, that accessibility aspect will be huge. And, you know, just being really proud of our councils and our members, because you all are absolutely amazing. You're so involved and you're so committed, and you bring such unique perspectives to this council. And so we really want to be able to highlight that for anybody who's looking at our website or might be interested in joining one of our councils in the future. So thank you for that. All right, I will pass it back over to you, Hope.
Okay, and it looks like I'm just going to be passing it over to Dennis for a public outreach and BHA media collaboration update, please.
Okay, thanks, Hope. And I promise Caitlin I'd keep this short, but there's just so much going on. If I get too long, just cut me off. Actually, I'm very excited. Last night I had an opportunity to meet Commissioner Smith and Deputy Commissioner Aaron Wester at a talking session about BHA and the plans into the future. And we had a small group, but we were all pretty engaged and even a little over the top, because we got to really talk about what we're passionate about with behavioral health. Commissioner Smith, I mean, is a true believer, and she really is looking to make some very positive changes. And had the opportunity after the meeting to sit and chat with her a bit. And she shares my view that it's very important for the BHA as well as BPAC to become much more high profile and where the public really knows who we are and what we do. And, my statement to her is that BPAC is supposed to be the voice for the public, and the BHA is supposed to implement. And she agreed with that. And so we talked about, different ways of doing that. She's very excited about the video podcast that I put together. And she has agreed to sit for an interview later on as we develop that further. The other thing is I now have someone. I was looking to the BHA for someone to do the genesis of the BHA as well as the 5 goals that the commissioner has put up as something to accomplish in the next, she says, 2 years and 4 months, which is Governor Polis's term. And Aaron Wester, the Deputy Commissioner Aaron, who the Commissioner Smith relied on heavily for a lot of detail in the presentation she made. Aaron has the background, knows what's going on, and she was very excited to sit for an interview with me to give the genesis and the forward-thinking 5 points. So she's going to coordinate that with Stephanie Bush in their media department, and that will be our next or one of our next podcasts that we're going to put on. And I've got others lined up, including Ryan, to be determined, and Caitlin has agreed. And Hope is going to sit for an interview to talk about the council. And that was another thing that Commissioner Smith was very, very bullish on, and that is a much tighter collaboration between the councils, advisory councils, and the BHA. And she, is up to speed and knows how things functioned before. And the changes that she is making is very important. So these listening sessions that she's doing, I mean, this runs right through the end of October in every corner of the state. So she is putting herself out there, and she's not shy about giving her opinions and accepting criticisms, even of the past functions of the BHA. But she says, "I hear you, and this is where we're planning on going." So anyhow, that is going to be a big part of the community outreach, but also a number of the grantees are going to be invited to sit for interviews as well. But also people who are not grantees or directly connected with the BHA will also be part of our best practices, behavioral health best practices video podcast. And actually, I'm setting one up with Precious at the Colorado Providers Association about their certifications. And so again, we're going to try and get as much information to the public as possible. And the BHA is touting this as a partnership with our community broadcasting network with behavioral health best practices. I also have set up a YouTube channel. I've got 4 postings right now, including the interview with Jordan on the Performance Hub. And I'm going to put my website in the chat again. If you go, it's right on the homepage where you can click right on the YouTube thing and get notifications of any and all new postings to the YouTube channel. So that's it. I'm gonna shut up now.
Thank you for sharing, Dennis. We'll moving right along to, unless anyone has any questions for Dennis or any feedback on what he shared.
I did just want to point out that in the chat, Megan Lovelace dropped our next community conversation information with the commissioner. It looks like our next one is going to be on September 18th in Grand Junction. And then it looks like we have one coming up on October 3rd in Fort Collins, and that exact information is going to be determined soon. So just wanted to point that out there for anybody close or that wants to go to Grand Junction.
There's also a virtual one, and it's not on the emails that Megan sent out, but apparently there's a virtual one too and a Spanish one, but they're not on the website, but they exist. So there's a virtual one later in October, I think, and then a Spanish-speaking one.
I can share a little bit more about those. So yes, our next one will be in Grand Junction, and then we're headed to Fort Collins. The virtual one that Megan just mentioned is just got scheduled for August 16th, and then we will head to Sterling, or I'm sorry, October 16th, and we will head to Sterling at the end of October. And so that one, it looks like will be most likely October 24th, but still shoring up those details. I will again send out communication, much like I did to you all for the Pueblo one, as well as the Denver one. You will be getting communication from me by the end of this week. So by tomorrow, for our next event that will be in Grand Junction. And at the bottom of that communication will be the outline of all of the upcoming ones. So you'll have when we'll be going and where we'll be going through the end of October. But you all can reach out to me with any questions on any of that, and I will answer what I can. And really appreciate you sharing these out with your networks. Commissioner Smith is very eager to connect with as many people as possible.
Megan.
Now I have a question. I have one that I signed up for, and it's for tonight. What's the one tonight? It's a virtual one.
That's not a BHA community conversation. It may be something else. Do you know what the title of it is?
I have it in mind as a BHA community conversation online, and I have a Google, it's a Google Meet link. I'll look it up and I'll check and I'll answer.
Yeah, let me know what that is.
I know we're a little bit behind schedule, so I want to go ahead and jump into the letter of recommendation prioritization review. And then we'll get down to the what's going on section with our lovely Ryan and Megan, and we'll be meeting our community engagement regional specialist team, which we're so excited about. So first of all, can everybody see my screen? Okay. So I wanted to share with you all this recommendations grid. So this is information taken from our letter of recommendation that you just submitted to BHA a couple of weeks ago. So what we have done is upon submission, we took that information to leadership within the BHA, and we really want to kind of break this down into categories, break this down into a level of prioritization, which we are going to be discussing with you all today, because we want to see your highest priorities. And then from here, we're taking this back to leadership within BHA, and then we're going to be designating task ownership. So that way in the future, we're like, okay, for example, we need information about how preventative dollars are being spent to address mental health disorders versus substance use disorders in rural frontier communities. So based off BHA leadership, we're going to assign that task, and then we'll be able to follow up with that direct point of contact in future meetings to, discuss this information further, get feedback from them, see how our recommendations are being incorporated into the larger BHA plan, and have these follow-up conversations. So today, wanted to kind of go through each of these. I believe, there is about 13 different requests that we made throughout the letter of recommendation. I wanted to work with you all to assign the priority of these, if they're a super high priority, a medium priority, and a lower priority. We understand that realistically, we want all of these to be high priorities. But for next year, since we do meet monthly, but again, that's only 12 meetings. And so we have to have a lot of things happening within our year. And so really want to be, as efficient as we possibly can and make sure that we get those super high priorities addressed and then start working our way down the totem pole from there, if that makes sense. Again, we realize that if in a perfect world, these are all high priorities, and if we had all of the time, we would be able to address every single one of them. But at least we want to be able to address some of the higher priorities within this year and keep working and moving forward from there. Does that sound agreeable to everybody? Does that make sense? Need some head nods, thumbs up. Okay, perfect. So again, we kind of broke these down according to the 4 categories that we broke down within the letter of recommendation that you all submitted. So we have the rural and frontier funding and program access, data and metrics, performance measures, and program recommendation.
Caitlin, can you enlarge just a tad, please?
Is that better?
That's great, thanks.
Great. Based off of our rural frontier funding and program access, these are some of the requests that we've made. The first request is how services are being provided in rural and frontier areas and how services are being accessed. Again, we have high, medium, and low priority. What are your all's thoughts about that? High for Megan?
High priority, yeah.
High priority? Okay. I'm gonna mark it as high. All right. So how preventative dollars are being spent to address mental health disorders versus substance use disorders in rural and frontier communities?
High or medium high, and I'm curious if this is already living in the performance hub somewhere somehow, or like it just seems like something y'all are tracking through that avenue currently. I'm not sure if y'all are, but that seemed like it would make sense.
Yes, I believe that we are. I think that we do need to get, additional information around that, but I think, what you were saying, Megan, about a medium priority, I think that does make sense. And especially when we're seeing more information about, how services are being accessed, that will probably overlap a little bit with, how funding is being allocated to those services, things as well. So are you all in agreement with a medium priority here? See some head nods, some thumbs up.
Yes.
Right. Your existing plans to improve meeting the needs in rural and frontier communities and more consistent opportunities for the BPAC to be involved in plans.
High. And that should be operationalized across the board, that the BPAC should be in consideration when existing plans that are meant to be improved are in the works. just so that we don't keep going, look what we did. It's done. We did it. Here you go, BPAC. No more room for input or anything.
If I could jump in for a second here, at our meeting with Commissioner Smith last night, the rural frontier area was talked about quite a bit. And I actually had an opportunity to say that we at BPAC have that as a very high priority. And people were very happy to hear that. But again, that is something on the commissioner's radar in a really big way as well. So I think you should know that.
Thank you, Dennis. All right, so marking as a high priority. Everybody okay with that? See some head nods, thumbs raised. Okay. All right. Moving on to data and metrics. How the block grant funds are allocated, to whom they are allocated, how funds are being tracked, managed, and spent, and outcomes of services being accessed.
Super high.
Hi.
This is what we
Sure,
asked
super
for.
Yeah, I was like, I think that is the highest priority if I'm based off of my interactions with you all and the report writing subcommittee. I think, yeah, this is number one on our list. All right. So moving on to our performance measures. Comprehensive data and performance measures that demonstrate the quality of care being provided and the client's quality of life during and following services.
That also feels high.
Super duper high. You
Okay.
need another box.
All right. Information about BHA's implementation of SAMHSA's harm reduction framework and the opportunities to advise BHA and the implementation process with a special emphasis on maintaining sustained dialogue with harm reductionists and people who use drugs.
That came from Michael. I don't think he's here today.
I don't think that he is.
But what would Michael say if he was here?
So I think, because that has a lot to do with some of his personal work, he would probably say it would be high. But thinking about, again, I wish that we could make every single one a high priority. So thinking about it in the larger scheme of everything, when we're trying to look at it from like a umbrella view, since this is more specific to this one framework, the harm reduction framework, does that make sense to make it a high priority or more of like a medium to lower priority at this time, and then keep escalating it in future conversations? Tasha, Dennis?
I want to say, and this is just my suggestion as just like a member of the public and stuff like that, with knowing about performance, just reading that, and since it is his recommendation, I would say, if you guys could hold off on that, because there needs to be a little bit more clarification, because it can be like my perspective is different than what his perspective is. So I think you guys should hold off on marking what priority that is, because it is his suggestion. Thank you.
Thank you, Tasha. Dennis?
Yeah, again, based on my chat with Commissioner Smith last night, and I brought up the fact that we were not getting information on grantees. And again, we were talking about the performance hub specifically, which I said was a great thing. Commissioner Smith was surprised that we weren't getting detailed information about the flow of the grant coming in and who was getting it. And she said, that's real easy. Those were her words. And I said, I think it should be posted right on the website let alone given to us. And she says, we will do something about that.
Thank you, Dennis. Maybe let's kind of move down the list and come back to this one, if that works. Think about it a little bit more. All right. So coming down to program recommendations. All right. So demonstrate increased support and funding for recovery support services in diverse settings.
That also feels like it would kind of already live maybe in the performance hub somewhere. I don't know if it does, but doesn't it feel like that would be something that we were measuring, like where these services were being you know, accessed, and that we're seeing more of those services accessed in those diverse settings. And I assume that we are utilizing all of the data through the Performance Hub towards this work here, correct? Where are our recovery people? What do you think, y'all?
This feels high. I know we can't have them all be high, but this feels really high, that the demonstrated increased support and funding for recovery support services, especially in diverse settings.
Everybody
I
in
I would agree. Sorry, Sean. Sorry, Sean, this is Natalie. I would agree because I don't know that we can assume, Megan, that this is in the performance hub yet. So I guess I would suggest putting it as a high priority. Yeah. Sorry, Sean.
No, I was saying.
Sounds good. All right. So leadership in the divisions of all of these. The statewide program, quality and standards, intergovernmental and community engagement, educate council members about current programs and services being offered and how services are being communicated to communities through a biannual one-page report explaining communication efforts.
Super duper.
I think that's important, but not as important as some of the other things.
Okay. So we have a couple of contrasting opinions there. Megan said super duper high, and Nat, you said maybe not as high. Should you want to come back to this one as well and kind of keep going through the list and see, you know, maybe where we fall, and if this one could take, you know, a medium priority versus a super duper high? Tasha?
Just my opinion here. Tasha Conker here, recovery liaison for BHAC, Behavioral Health Administration Advisory Council. I feel like us advisory council members, no matter what council it is, it's a board and it's commission. How are we supposed to help the public if we don't know what there is? And my recommendation would be a quarterly instead of biannual, because things are constantly changing within the system on a day-to-day basis. So things, policies, procedures, rules, regulations, it's changing. So we need to be informative to our community members. It's to all the people of Colorado. It's only fair to them. So that's my opinion. Thank you.
Thank you, Tasha. Yeah, so this language was taken directly from the letter of recommendation that we've already submitted. So I think what we could do is start with that biannual report and then start moving, you know, seeing from there, like, is that enough? Do we need, you know, more frequent report check-ins and things like that? So that's why the biannual, it's just taken from the report that we had already submitted. Margie?
I just think if those kind of reports then are posted on the BHA's website or that information, then going with what Tasha said, it's a way for more people to really get that kind of information, which I would say that right now is probably very few people have that type of information. So being posted is really important.
So it sounds like we might be leaning a little bit more towards a high priority. Well, why don't we come back to this one in just a moment and kind of keep working through our list and see, if we have some wiggle room for, a lower priority somewhere. Because right now it looks like we just have one medium and the rest are highs. So just want to keep working through this. So we'll come back to this one in just a minute. So our next one is request for leadership to attend at least one council meeting biannually to provide and review a biannual report with BHPAC. So that would basically be in congruence with this one. So here what we're asking is for these leadership, these positions of leadership to come and have regular check-ins with the council to explain, what current programs are being offered, how we're engaging with communities, and get your all feedback, and then incorporate that into plans moving forward. And then in a couple of more months down the road, we come back and do a check-in and, show you all how your recommendations and questions have been answered and incorporated, and kind of keep that feedback circle moving forward. So in addition to that one pager, we'd have them come and speak with you. And so that way we have those two types of mediums to be able to support you all and to communicate with you all. So we have that verbal and direct, and we also have it written black and white as well. So those are kind of the intersection between these two.
I think that's a high priority, especially with different types of learners. Some people will learn by hearing and others will learn through that written. And so these two do really feel like one and the other should be happening together. And they're both important because I think at the very beginning of this, when we were like, why is there no data? Oh, maybe we should hear from leadership, right? Like it was our organic thought process around better understanding what our job is as a council and how to do it to the best authenticity, right? So do you believe these are both high? Even if we do everything high, I think in partnership with other leadership in the Behavioral Health Administration, it doesn't look as much of a heavy lift as it does when we mark as many things as we are high. We should not be afraid of having a lot of highs in this space, because probably when you do bring it back to leadership and make those assignments, we'll all kind of understand that there's already humans in the BHA working in this space towards these goals.
All right, so I'll go ahead and mark these two as high. Moving down the list. Information regarding a support process protocol for caregivers to include a brief summary on the process and an organization chart that includes points of contact for how to elevate an issue, topic, or how to access additional resources for children, youth, and adults with mental health or substance use disorder.
That should be high, period.
Agreed.
Excuse me, the mailman is here and my dog's going crazy. All right. Demonstrate how money is being spent, the impact it is having, monitoring protocols in place, and regular updates being provided to stakeholders. BHPAC requests to be involved in conversations about monitoring and feedback to consumers. Another high? All right. All right. Demonstrate how money is being spent, the impact it is having, monitoring protocols in place. It's basically, this one is for children and youth funding specifically. That one.
Hi, especially with all of the movement in this space currently. Lots of things are changing quickly.
All right. So request for leadership from statewide programming and intergovernmental community engagement to attend BPAC meetings quarterly, to educate and update members about current intervention and primary prevention training programs being offered to caregivers, families of children with youth and behavioral and SUD or MH diagnoses.
As we've heard publicly in report backs from the Behavioral Health Administration, both these community engagement folks that work for the Behavioral Health Administration and councils like ours are often mentioned as this sort of real-time feedback loop for leadership at the BHA. And because we hear so much about this is what is meant to happen, I feel like we should just then go ahead and do it. And that's a part of I think what the request is. You know, these engagement coordinators are familiar with not just our council, but the other councils, and feel like they have enough relationship with us that they can circle back on things they're hearing in community or what is being operationalized. And so it makes sense for one of them to be attending these meetings. Because it's a shared resource and we should be utilizing it appropriately.
Thank you, Megan. All right. So another high priority. All right. So taking a look at this from like a bird's eye view here. I just want to be, you know, realistically, in this perfect world, we will get to absolutely every single one of these and be able to address them within this next year's time frame. But you know, just not wanting to set anything expectations too high to where we you know fall. Is there anything thinking about this that we might be able to go through and possibly move down to just a little bit lower of a priority? Or do you all want to just stay with these high priorities and kind of see where we can get within this next year?
It's okay to be high. That was a joke. Everybody laugh. But honestly, right? Like these are priorities, and each of us in our own organizations are constantly dealing with these crisis situations where if the things in the first column were addressed and operationalized, we wouldn't be getting like panic phone calls multiple times a day around some of these issues. Or when we were, community members, leadership, whoever you are in whatever organization you're in, would have better access to the resources quicker, right? So that we were able to mitigate some of the horror stories that we're hearing, you know, up in Lake County, the tragedies that have been happening up there. I mean, it's endless, right? And so we need to keep these high, to keep them on the radar. And I hope it doesn't set off alarms within the BHA, because there's so much cross-sector and cross-agency work that just staffing that question in a room with people with a lot of resources means that they'll go, well, my department's doing this thing already. Oh, well, we did this thing over here, right? So it's probably not as much of a heavy lift as it looks like on this spreadsheet once we're just out there actually staffing these.
Definitely. And there is,
Very
you know, there's a lot of overlap
guys.
between them.
Really optimistic.
Yeah, definitely. There is a lot of overlap between them, you know, because if we address one thing, you know, that there is going to be some things within the other requests that might answer as well. So there is definitely some overlap there. So, all right. Sounds good, everybody. Well, we will take this back to our BHA leadership team. And then from there, again, we're going to do some task ownership designation, and then we'll start planning some times to come in and start working with you all and the council as a whole to, you know, educate you about what we currently have, get recommendations from you all about, you know, goals and plans moving forward, and then continuing that feedback loop to show you, you know, how we've answered your questions, how we're addressing some of your recommendations, comments, and concerns, and we'll just keep that feedback loop moving forward. You know, nothing is absolutely set in stone. We want to have these conversations. So, you know, they bring us information, we give it back, we show you how it's done. And if we need to adjust, you know, that's absolutely possible. We can adjust if we find out, you know, this is one metric that we thought we needed. However, it's not answering the question that we have. Let's pivot. You know, that's what we want to have in these conversations and these council meetings moving forward, definitely. All right. We are back on time, everybody. Look at us. All right. I will pass it back over to you, Hope.
Okay, so we're gonna see what's going on. This is something that even as the chair, feel really new, not only to my role that I'm grateful to be in, but on this council. Are we having these prevention, treatment, recovery groups? Are they meeting?
So these, not the subcommittees currently, and that's something that we should definitely discuss at our October meeting as well, is seeing, you know, which subcommittees, let's kind of maybe do like an internal audit, because some of them have been meeting consistently, some of them have not met in an extended period of time. So we should definitely, you know, review subcommittees and see, you know, if they are still valid at this time, if this is something, you know, we should designate other resources to at this moment. And again, nothing set in stone. We can always bring these conversations back up. And if we find that, you know, a subcommittee is needed for a specific task or things like that, we can absolutely work with the council as a whole to create one and move forward. But also, you know, just what's going on in your all's communities and your neck of the woods, you know, people who are involved in recovery, for example, if there's any community events that are happening, and especially with September being Recovery Month, I'm sure that there is a lot of information that we can share with the council as a whole. But yes, for certain subcommittees, they have not been active, at least since I have been here since April. And so we can do an audit in October to kind of relook at all of that and see if that is something that should still be standing at this time, or if we could just allocate different resources and funding and time and energy to a different location at this point. Megan?
Sure, thank you. And I'm just curious with these new team members, the regional community engagement team, and if they're coming to, one of them is coming to every one of these meetings, they probably also are working in each one of these spaces, right? You know, so they might also have some info or things to share around each one of these categories. And you know, as we brought in our ideas around prevention, understanding that prevention means keeping everybody safe, healthy, and in their homes, that's going to be in the purview of the regional community engagement team. So even if we don't have a subcommittee that's active, hearing from those regional community engagement team members around how they're, you know, out there in the community, learning from folks who are doing that work or implementing work, it gives us a bit of a broader view than it being just in a ball of the BHPAC. So just a suggestion moving forward that when these community engagement team members join us, that they are aware that one of the things we do in these meetings is talk about what's going on with prevention, treatment, recovery, maybe not legislative. I don't know how much they work there, but in the other three buckets, they're interacting in that space all the time. So also
we have Ryan for with legislation.
So bringing them forward, right, as a part of the conversation and not keeping them separate from what the subcommittee work may or may not be doing currently. And Sharon, I'm talking so much.
Definitely. And we will be hearing from our regional specialist here in just a little bit. So it's super exciting to start having them be a part of these meetings and a part of these conversations. And we're going to learn, you know, more about them, their roles, responsibilities, and establish some communication patterns and expectations between us as a council and them as regional specialists, and really excited to develop these relationships. Sharon, you have your hand raised?
Yes. Hi, everyone. I was going to say, I can actually give a quick kind of prevention update on what's going on in the state. Usually it's Bonnie Holiday that represents kind of prevention for our team. And so she is on a lovely vacation in Spain right now. So I am sitting in for Bonnie.
Hate that for her.
Yeah. So I
Thank you
know.
so much, Erin.
Yeah, so I know she sits with somebody on here that is part of the prevention subcommittee. I think it's just one other person. I don't know if they're here today, but I will just quickly introduce myself. So I'm Sharon Liu. I am the director for the Community Prevention and Early Intervention. And I basically oversee all of the SAMHSA SUPTER's block grant prevention set aside money. However, we are located over at CDPHE and no longer located at the BHA. And that's due to legislation where they pretty much plucked our team out of BHA or when it was about to happen and put us down in CDPHE and the Prevention Services Division. So we still have a very strong connection with the BHA in regards to the block grant and meeting all of those requirements for prevention. But I just wanted to share some cool things that we're doing, at least statewide. We just finished a statewide substance use needs assessment. And so that is available. If any of you are interested, I'll send it either to Ryan or I know Ryan, so maybe I'll send it to Ryan or whoever else I need to send it to pass it along. And this needs assessment basically gives the landscape of what's going on with substances across Colorado. In addition to, we did a listening tour for all the communities to figure out what are they needing in regards to prevention. So it has a summary of that as well in this whole big report. It's a 75-page report, so it's a nice read, but it gives you an overview of what's going on in Colorado for prevention. And then just to let you know what we're going to be doing with this data then is we're actually embarking on another statewide prevention strategic plan. So we are taking that data and then we're going to be using that to create a strategic plan for substance use prevention. If any of you are interested in that, let me know too. And one of the other things is we also have a 1276, which is a legislative bill that says we had to create a prevention collaborative to focus on the last round of the statewide strategic plan. So we have that group going on. So we have a diverse group of people across the state representing prevention and letting us know how can we strengthen the infrastructure, how can we do a better job of funding folks for prevention and all that good stuff. So if any of you are interested in joining that meeting, let me know. And then the last thing I just wanted to say is we were actually able to bring money into Colorado. We applied for the SAMHSA Strategic Prevention Framework Partnership for Success for States grant, and we are actually awarded the funding. So it's 1.25 million for 5 years, and we wrote it so that we are going to focus on the Northwest region, which is Jackson, Moffett, Rio Blanco, and I'm missing one more. But it's the Northwest region where they have high rates of youth substance use and may not necessarily have enough resources. So we're going in to help that region over there. So by starting some community coalitions. So that is the prevention that's more from the statewide perspective and more for what's going on when we are for the SUPTER's block grant. So just wanted to kind of give you an overview in case you didn't know. And feel free to reach out to me if you have any questions about substance use prevention. We focus on primary prevention. So just to let you know, we really try to do upstream and get to the root causes, and we have a hard hill to climb, but data has shown that we have reduced, well, it has been shown, not we, sorry, can't attribute that, but we have shown that substance use is down among teens. So, yeah, thank you.
Thank you so much, Sharon. Are you able to send me that meeting information about some of these prevention conversations that I could forward to the council as a whole?
Yes, I can send you all the information that I just talked about.
Awesome. Thank you so much. Yes. So if you can send that my way, I'll forward it out to everybody as well. And then, Sharon, I dropped your email in the chat. I hope that's okay.
Oh, yeah.
So, for anybody who has maybe some additional questions, definitely don't hesitate to reach out to either myself or Sharon. And then I'll be working with Sharon to get all that information to you, because this is great and very important information. So thank you for that update.
Thank you.
Phyllis?
Morning, everyone. I'm glad I could join our meeting today. I'm sorry I was a few minutes late from a doctor's appointment, but I'm the director of our Health Education Services Office at the Colorado Department of Education. And we are in the middle of releasing we have our grantees. We have about 30 grantees right now on our new vaping prevention education grant out of our office. And so we're really excited to get that started and connecting it with our other work that goes on across CDE and in our office with grants. Currently, we have our federal grant, which is Project Aware, which is a systems building grant for grantees across the state. And we tap into the systems building work for behavioral health specialists in the district, and that touch on all levels of mental and behavioral health supports and substance use prevention work. And so that is in addition to our school health professional grant, comprehensive health education grant, and student wellness grant. And all of them are trying to support the schools and work off of the data of what their greatest needs are right now around mental and behavioral health work and substance use work. And so we have one more federal grant that is still out that we're getting some good feedback on right now from our application. And we're very hopeful that we will hear back from that in the next week or so. And it is from the federal level, and it's a behavioral health grant also that will support strengthening our behavioral health specialists across the state and working with schools and districts on what their greatest needs are, and just trying to strengthen that system for the longevity of keeping our behavioral health specialists in the buildings, which we know is greatly needed and we're at a deficit of right now. So.
Thank you, Phyllis. Megan?
Thank you for all that great information, Phyllis. And I just have a question around some current practices in rural school districts where whenever they encounter a young person whom they think maybe might need some behavioral health intervention, they are told by their district to report that child to child welfare, and that child welfare can screen them out and decide if they have a mental health or behavioral health need that needs to be addressed. And just reflecting back with you that in our rural spaces, we have not seen that be a productive way to interact with families who have children that need behavioral health support. So will some of this funding help to train these schools that it is maybe not the most appropriate way to address a young person and their family when they're struggling with their mental health?
And that's a great question. And I can tell you just through our office, as we work with our grantees in our various grants, and we are really focusing on strengthening the behavioral health specialists in the building. And they use a lot of their funds to do that piece of the hiring, because we know that, especially in our rural areas, they do not have large behavioral health teams. And so we are looking for adding those into the rural areas so that they can work in strengthening across their district with other team members. B, providing that prevention education also to families. And then the other part, which is a big aspect of the grant work, is finding their community partners that are doing behavioral health work. And many times, some of those community partners are also coming into the schools and doing some prevention at that tier 1 level prevention education work with all students. If they, oftentimes in the rural areas, they do struggle with the hiring because of either the amount of dollars available or getting people to live in some of those rural areas. And so it is a partnership that they have to have with the behavioral health specialists that are already out in the community, and not sending misinformation, if I can say that, to the students and families and school leaders, so that the students are receiving the right level of care. And what's through our school health professional grant, we have been able to support the schools with, if they want to do an MOU, a contract with some of those community partners to come in and do, if they're therapists, and do therapy work with the families and students. And that has been very successful, because what we're finding is many times the families trust the school building. And also they have that convenience of being able to come directly there to the school instead of having to travel many miles away in order to get that kind of therapy support. And so we're hopeful that this new federal grant that we're hopeful we'll get, that will strengthen this kind of work in the school areas, or in the rural areas also.
Thank you for that.
You bet.
Thank you, Phyllis. Thinking we should probably keep moving forward so we don't run out of time for our intros here. So I guess feels like we kind of did a good, thank you for a thorough on the prevention. I'll just leave it open, any treatment or recovery updates that anyone wants to share. I know, Sean, I'm sure you have one, so I'll make sure we get time for you.
If I can just say quickly, we have a list of recovery events that are happening this week. So I'm going to have Sean go, because I think he knows about multiple of them. And I will send out the list when I get it. I just emailed comms to get that from them. So I just wanted to say that. Sean, you're up.
Yeah, so September is recovery month, so there's a ton of stuff going on. Here in the Metro Denver area, we have our big Rally for Recovery. That's at Civic Center Park. We march from Union Station into Civic Center Park starting at 11 o'clock. The rally kicks off at noon once we get into the park. I'm going to drop a link in the chat for if there's any organization that works in mental health, substance use, or works adjacent to that, youth prevention, any of that stuff. We offer free booth space at this rally. So if you're interested, there you can sign up in the link I just dropped. There's also the recovery rally happening in Sterling on the 28th. Durango is on the 28th. In Colorado Springs, it's on the 14th. And then it is Mobilized Recovery is coming to town. That will be on the 30th. There'll be a bus stop in Castle Rock at the Douglas County Fairgrounds. Yeah, we'd love to see as many people as possible as at that rally in the metro area or any of the other rallies. Just showing support for recovery, live music, food, and hanging out with other cool people in recovery.
Thanks so much, Sean. Tasha.
About September 30th, with the mobile recovery bus, the commissioner will be there. And I believe Hard Beauty out of Castle Rock is going to be doing that. I'm a Hard Beauty gladiator. So yeah, spread the word about that. Yeah, and if you guys could send me all the recovery stuff throughout the state that you guys have in the recovery team. I put my email in the chat so I can get that out and start advertising to our communities, getting it out to the people that throughout the state that I am connected with too, as well as our advisory council. So thank you. I appreciate that.
I just wanted to mention really quickly that Commissioner was invited to attend on September 30th, but I don't yet have confirmation that she will be there, Tasha. So unless you heard something different than I did, I just want to put that out to before people get the word out that Commissioner is there, that I don't know that it's going to work with her calendar. I can't confirm that at this point.
Sorry, Megan. All right. And I will work with Aaliyah to get that information from comms, and I will send that out in a follow-up email to all of you as well. All right. So for the sake of time, Ryan, do you want to give us a brief update about legislation, and then we can jump into our awesome regional specialist?
Good morning, folks. Ryan Templeton, Policy and External Affairs Division Director with the Behavioral Health Administration. You may have heard that there was a special session. Special session means the governor called all of the legislators back to the Capitol to get a thing done. This was about property tax and only about property tax. So nothing behavioral health super specific, but it does impact tax revenue that then funds services for state agencies. So there is a little bit of an offshoot there. There was a tax cut because there was property tax rates are going very, very high. So part of that agreement was the initiatives or ballot measures being taken off the November ballot because they passed House Bill 1001 to have some tax relief there. So nothing specific to BHA within that special session. The special session is now over. The bill was signed yesterday by the governor. So that's the special session update. Like I said, there wasn't anything that BHA was specifically involved in outside of other things happening at the General Assembly that is not related to the special session, which includes interim committees. Interim committees are committees that essentially work year-round, not just during the 120 days that is every year the General Assembly meets for 120 days, starting in January, ending in May, where they actually go over bills. Interim committees meet essentially during the summer, and one of the committees, the behavioral health, or the interim committee on the treatment of behavioral health disorders in the criminal and juvenile justice systems, which we call BHDCJS as its acronym, has drafted their 5 bills. I will share their website with this group related to where you can find those bills. The next interim committee is scheduled. So that interim committee chaired by Senator Daphne Michelson-Janae and vice chaired by Representative Judy Amabile. Their next meeting is October 1st to go over these 5 drafted bills. You'll see in there that tab where it says legislation is where you can see the 5 bills. Bill number 1, the deflection support justice involved youth. Bill number 2, behavioral health crisis response recommendations. Bill 3, not guilty by reason of insanity defense. Bill 4, complementary behavioral health services and jails grant. And Bill 5, competency in criminal justice system services and bail. Those are the 5 bills that are drafted. That does not necessarily mean that these bills will ever get introduced, as there still needs to be that decision made by the committee. If you're interested in participating in that, it's an open, it's just like any sort of committee meeting during the session. They're at the Capitol where they meet. Shout out to Stephanie Johnson, one of our BPAC members. I saw her down there when the committee met earlier, or I guess last month. I guess it's already the 5th. So it's open. It's up on the 3rd floor of the Capitol. For you to participate in watching how bills get made and committees meet. So that's that. There, 2 of those bills as drafted impact BHA directly. It creates a complementary services in jails grant program for $50,000, as well as it does some additional crisis support and data collection. Those are 2 bills that have a direct impact or requires BHA to do something specifically. So be on the lookout for those if you're interested in what people are saying BHA should be doing related to those bills as well. But that's my quick and dirty there on the current interim. I will offer up that in preparation of the 2025 regular session, in the past at BPAC, me and my team have done, hey, let's get an intro to why we are here. What is the legislative branch of government? What is the executive branch of government? What is the judicial branch of government? And I will offer that up to this group if you are interested. BPAC again to just kind of set the stage for a successful 2025 legislative session and how we can work together about what updates look like throughout the process when we are hot and heavy into the session come January.
Ryan, could you also cover for the group just what the Joint Budget Committee does and the role they play, specifically when it comes to the tornado that appropriations can become kind of at the end of the session? So I think it's useful when you know what the different branches do, how that relates to the Joint Budget Committee and the passionate arguments around why certain bills need certain fiscal notes.
Yep. So the Joint Budget Committee is a year-round committee that you can argue that holds all of the power at the General Assembly because it's related to money, right? Money is what drives the action. So the Joint Budget Committee is that committee that approves kind of the state's budget. So the governor submits the budget to the Joint Budget Committee, and then on November 1st. So a big date in Colorado is the governor's release of the budget that gets sent to the Joint Budget Committee. The Joint Budget Committee is 6 members that represent both the House and the Senate, that then makes the determinations about accepting the governor's budget, making corrections or making changes to the budget, and ultimately passes that budget as affectionately called the long bill. So our state's budget for the year, which then that's when the 2025 session really takes off, because we need to know what the state budget is. So then that's what identifies all of the rest of the budget for the special bills. So that's why the Joint Budget Committee is a big player. There's Joint Budget Committee hearings and briefings as well before the session starts. So you'll see as soon as the governor's budget comes out November 1st, they'll get date scheduled for all state agencies, including the Behavioral Health Administration, to go to a briefing and then a hearing with the Joint Budget Committee about BHA specific budget. Same with Healthcare Policy and Finances specific budget. Same with CDHS's, or the Colorado Department of Human Services specific budget. Each state agency has a briefing and a hearing in front of the Joint Budget Committee, usually in November, oftentimes, or usually most of the time in December, sometimes the week of Christmas if you're wanting to participate in that as well. I don't think we've had dates scheduled yet, but it's also an interesting opportunity to listen in on that. Frank.
Hey, Ryan. I just had a quick question on BHDCJS and those bill drafts. Are we at the point where changes to those drafts have to happen via amendment?
Yes, good call, Frank. So because they have been published as these original bill drafts with bill designations, they can only be amended or changed by amendments come January when the session begins. So right now they're going through a fiscal note process to come up with this is how much this is going to cost, which will make the determination during that October 1 if those bills move forward to become an actual bill that will get introduced. And then that's when changes would potentially happen, or adjustments based on those bills. So with that, kind of offer on the table was the get ready for the session. Might be a good agenda item for, say, the November BPAC meeting. Just thinking about timing with the governor's budget coming out immediately prior to the November BPAC meeting, which is scheduled for November 7th. But I will let the group put a motion forward on that if you want me back in November to talk about, let's get ready for the session.
Motion to bring Ryan Templeton back to tell us all about the mysteries of the Colorado State House in November.
Seconded.
And also, just so y'all know, because the JBC, the Joint Budget Committee thing happens like before Ryan will tell us all of the amazing things about the State House. But if anyone's super interested in getting in the mix with the Joint Budget Committee, I torture myself with that. So you are welcome to be on that journey with me if you so choose. It's a lot of just listening and then wondering what the heck they're talking about, but you're just kind of researching right along with it. But it's I think, to that group of humans and understand where their priorities are and what kinds of questions they're actually asking Ryan and other members of not just the BHA, but other organizations that work adjacent to BHA to achieve those collective goals of person-centered behavioral health care.
Nice. And I was not following along in the chats. If there is anything in there, let me know. I know Andrea has an update on legislative implementation. If we want to kick it to you, Andrea.
Are we ready? Okay. Quick update. This will be just a fast coming attractions for what hopefully you will see tomorrow with more information is an email coming out on the Friends and Family Input Form. This is pursuant to legislation that passed this session way earlier this year, which feels like a different universe timeline now, which was 24/12/17. And this is kind of a compound bill. Here, let me drop it in the chat in case anyone wants to look. So OHI is which is the Office of eHealth Innovation, is studying consent repository and a universal consent repository, and they're doing some activities around that we're plugged into as BHA. But what BHA is responsible for is the development and use of a Friends and Family Input Form, which is really designed to allow loved ones of someone receiving behavioral health services an opportunity to present information that they may have about their loved one that would be helpful in their treatment to that treating provider. You will notice in the bill, there's a lot of, obviously that sends off a lot of privacy law, alarm bells. We've got a lot of interests involved here that are going to help us craft this in a way that's helpful for the system. We are doing 3 stakeholder meetings coming up, and I will drop the dates in the chat as well in just a minute for those. We're doing September 30th is the big kickoff virtual one. October 14th, I will be in Boulder doing this hybrid in person and virtually. And October 28th, we will be up in Alamosa doing it hybrid that way as well. So again, more information will be coming out hopefully in a comprehensive email tomorrow morning. I have Caitlin giving me the email list of every council member that we have across BHA. To that point, I will try to eliminate duplicates. Please forgive me if you get this email a couple of times just because of your involvement with BHA and how many lists you may be on. And the email will have a little survey in it that says, hey, which one are you interested in attending? The whole point of these stakeholder sessions is to hear from the communities that will be using these forms, right? About what we're getting right, about the content of the form itself. What are we asking? Are we asking it in the right way? We'll also have a discussion about the systems view of how this form will be utilized by providers and how that BHA will have oversight into that and how the form will feed into our performance hub and all of those fun interconnections, right? And I will have this agenda for these meetings published well in advance with the materials, the draft form, so we all know what we're talking about when we go there. And I'm actually really looking forward to this. So
thanks for leading on that, Andrea. And so super important to make sure every human that we're caring for is getting the right input from and around their caregivers. Thank you so much for leading this work. And it's really going to change the way that people meet each other in that space of crisis and care. I'm so excited y'all are doing this.
Absolutely. Thanks, Megan, Andrea, and Ryan. I'm going to turn it over to Megan Shelton so we can get to our introductions for community engagement team.
Hope, I apologize, but I'm getting a call from the commissioner, so I will join momentarily.
All right. Well, I can help in the meantime then. So I know that we have been long anticipating meeting our regional specialists and starting to get to know them and understand, our relationship with them, communication patterns with them, and things like that. So I see first on my list over here, I'm just going to start calling people out. Mariez, if you want to come off mute and introduce yourself.
Sure, thanks. I'm Marius Nielsen. My pronouns are they, them. I live in Colorado Springs, and I am the Regional Community Engagement Specialist for the Southeast region that covers Colorado Springs and Pueblo, up into a couple of the mountain communities, the San Luis Valley, and down into the southeast corner of the state. I'm going to pass it over to someone else.
That would be great.
Awesome. Rachel.
Thank you. Hi, everybody. I'm Rachel Simpson. I use she, her pronouns. I am the specialist for the Western Slope. So all the way north to south, Western Slope. And very happy to be here. Happy to meet everybody. And I will pass it over to Brittany.
Hi, y'all. I'm Brittany Noble. I use she, her, or they, them pronouns, and I am the Community Regional Engagement Specialist for Region 2, which is the Denver metro region. And you can see I put the map. Oh, I always use numbers. It's actually letters. Region B. I don't know if I said 2. it's confusing. Thank you for projecting that, whoever is doing that. So I'm the kind of reddish region there. And then you'll see Marius, who introduced themselves first, is the green region. Rachel's region is over there on the left, is that blue region. And then Calandra, who's going to go last, is the yellow region. So, and I live in Denver. So nice to meet everyone. And I'll let Calandra introduce herself.
Good morning, everybody. Thank you for letting us crash your party. I'm Calandra Lindstadt. My pronouns are she, her, or they, them. I am your community engagement specialist for the Northeastern region. So yeah, Jackson, Larimer, Boulder, all the way over out to Sedgwick, Phillips, Yuma, Kit Carson, and everything in between. Just real quick, I actually grew up out in Logan County and graduated from NJC, was a swimmer for Sterling High School. So I'm really excited to be back and serving this community that gave me a lot when I was a kiddo. I live in Loveland. So if anybody's in the area, I'd love to connect and grab a coffee, get to know you.
Thank you all so much. I don't know if Judith has joined us today. I'm not seeing her on here, but Judith is our new regional specialist manager. I think she's like maybe 2 weeks into this. I know that she's relatively new, but I had a chance to meet with her on Tuesday, and just so excited to start working with you all and building these strong relations. I'm going to pass it over to Megan because it looks like she is good to go now.
I am good to go. Thank you all for your patience. I walked away from my computer, so I don't know exactly what I missed. But it does sound like Caitlin explained the role of the specialist, which I had shared with you all as we were developing them. So we are really excited to have them. They are starting to get out into their communities, and have been joining me and Commissioner Smith for community conversations that we talked about a little bit ago. I also wanted to let you all know that fresh off the press, we just finalized a PDF document that has the map that is on your screens right now, and it has how to get in contact with each of the specialists. And so I just sent that to all of you. So you should have that in your inbox. If you don't, feel free to reach out to me or to Caitlin, and we will make sure that you have that so you can contact your specialist in your area if you have any questions.
Thank you, Megan. Tasha, I see your hand up.
So as I'm looking at these regional specialists and stuff like that, how, and maybe this is where I'm a little confused because our rates are changing, come 2025. So I know Region 2 is all the way from Larimer County all the way down to the southeast side of the state to Lamar, all of that. So how are these regional coordinators going to be like incorporated with the regions? Like, where is their place in that since it's all changing? That's where I'm really, really confused.
I can take that. So Tasha, these are not, so intentionally, we did not design the regions for the engagement specialists to be the same as the Boston and Ray regions. And the reason being, as if you look at the map for Boston and Ray's, one region is really tiny, one region is like half the state because it's based on population. And our model is based on them being able to travel within the regions. And so they will be working with the BOSSOs that are in their regions, which means there will be more than one specialist that will be engaging with a BOSSO. So there will be some overlap with that, which is good. That's what we want. We want to make sure that everything we're doing is really inclusive. And so as we continue to move forward with BOSSOs, they will be very involved with that process and ensuring that they're connected with the BOSSOs that are within their regions.
Okay. And then also, because I'm in Region 2, soon to be Region 1, I believe is what it is when it changes, but I'm still getting my behavioral health in El Paso County. So who would be like the regional care coordinator that I would contact for that region, since that's for my, like with my care. Does that make sense? I mean, there are people going all over the state or even out of state to get care. So I just want to know how I contact the regional care coordinator or people in that area, and also with the community and throughout the state. Am I making sense there?
I think so, but that seems kind of like a BASO specific question, which I think we will be able to answer more specifically over the coming months, as we start to move forward with BASOs.
And we can
Okay.
talk about this more later as well, Tasha. If we're
Yeah, I'm just really
specific.
confused on how this is all breaking down with the system changing and everything else, and with the funding and how the care coordinators come into play with all of this change. That, I guess that's what I'm needing to know more information on, especially when it comes to recovery and services.
Yes, we can definitely start talking about that a little bit later, Tasha, just to get redirected back into this conversation. So it looks like the regional specialist dropped their information, like where they're located and their emails into the chat. And then I will also, Megan said that she sent out that PDF with their contact information. I will also link that again in the follow-up email that I'll be sending out to you all, so we can start getting in contact with these regional specialists, introducing ourselves, and then maybe for the next meeting, we can invite them back to, start kind of talking over with them, some communication patterns that we would like to see between them and the councils as a whole, and start outlining some roles and responsibilities that we have for them and that they have for us. We really want to develop this two-way communication and this mutual beneficial relationship, and be incredibly involved in them and their work, and us support them and they support us. So I think that would be great to possibly bring up at the October meeting, if that's something that you all are agreeable with. Seeing some head nods. All right. So it looks like we did have a motion that you all had brought up during the executive subcommittee meeting. I'm gonna pass that over to you, Hope.
Sure. Could we get a motion to create a regional specialist update as a standing agenda item so that they can come and join us and provide updates?
So moved.
Second.
This is Charlie. I'll second.
Thank you both. So great. We've approved a motion to create our regional specialist update as a standing agenda item monthly. Thank you all. And what a pleasure to meet you. Welcome, our regional community engagement team. Thank you. And being at time, is it required that we do just an open for public comment, or are we able to adjourn at this time?
Yes, we'll just give it a minute for public comment. We won't have to take the full 5 minutes, but we do need to create some for public comment. So any members of the public that would like to come off mute? Charles.
Yeah, I just wanted to announce we have an open house at our new Circle program in Pueblo West, so I wanted to invite everyone.
Thank you, Charles. Do you have some additional information that you could send us a link to, and I can forward it along in an email?
I will, yes.
Thank you. All right. Anybody else? All right. I will pass it back over to you, Hope, then. So go ahead and formally adjourn us.
Well, thank you everyone for your time today and being here and all that you do. And meeting is formally adjourned. See you next month. Thank you. Take good care.
Thank you, everybody.